Jeff Houghton here with Nadia Sirdar. Nadia, tell me about yourself. You got some big news coming up, right?
Yeah, I'm opening a direct primary care practice in Bethesda, Maryland. It's called Bethesda Modern Primary Care. And my focus is really to sort of create something in the community that is really intentional
Mm.
and really easy. And sort of when everybody talks about a medical home, that's kind of what I want for my neighbors and friends. So
Yeah.
that's what's opening.
So what do you mean? What do you mean by medical home?
Yeah, so I think a lot of healthcare at the moment is very fragmented. When people get sick, when people need somebody, they try to call, they don't get through. Somebody calls them too late, they're already in the ER. And I work at Sibley Hospital right now. It's a Hopkins community hospital. And so we see some really, really sick people. And I've been there like 8 years. And the refrain that I keep having in my mind is like, oh, I wish they had gotten to their doctor before they got here,
Yeah.
just because they're so, so sick.
Mhm.
And I know we can do better. So the idea is that if you have access to a physician, if you have access to come and go as you please, then you will feel better and get better, and you won't be that sick. You won't end up in the hospital.
Yeah.
Right.
Yeah.
So that's the idea.
And you're talking like your practice is, you said it's modern. Is that what
It's
it's part of
Bethesda Modern Primary
modern?
Care.
And what
Yeah.
I think is interesting about DPC is it's both modern,
Right.
forward looking, and like, let's do it how we used to do it
Correct.
with relationships and stuff, right?
Totally. Like going back to the old school, like doctor bag, you can take it anywhere and take care of anyone.
Yeah.
Yeah.
So, what are you excited about for making this transition?
Yeah. So I think the biggest thing for me is right now when I take care of patients, I end up kind of figuring out or trying to figure out what happened to them after, right? And once they leave the hospital, I don't really get to see, if they're okay, if they're not okay. So I think what I'm looking forward to the most is just having that relationship and where I can keep them well. I'm the eldest of like six, and I'm really bossy, and I always have to make sure everybody's okay. And I just feel like I want to do that for my patients.
Yeah.
And I just want to have a space to do that for them and take care of them because I think I would be a good advocate.
Yeah.
Yeah.
So for people that haven't um, experienced direct primary care, how do you describe it to people?
So the way I describe it is, when you have like a neighbor or friend or a friend of a friend and they say, oh, so and so's a doctor, so and so's a nurse, or um, and you have like a crazy emergency and you feel kind of desperate because no one's calling you back.
Mhm.
You'll call that person, and that person has been me historically
Yeah.
in my little community of Cabin John, Maryland.
Sure.
And so now I feel like this is sort of just formalizing what I do already.
Hmm.
Um, so I feel like what I look forward to the most is just like serving my community and
Yeah.
continuing the relationships I already have and
Mhm.
creating new ones.
Mhm. And will people have people with DPC people are members, right? And
Right. So the way it's set up is you pay a membership, kind of like a gym,
Mhm.
and then you call the doctor whenever you want, email, text, and the main thing is access, right? So I would call somebody in for their annual exam. We would talk for an hour. Then I'd call them back for follow-ups and labs. And there's no sense of like urgency. Like you don't have to keep watching the clock and say, oh, well, your 7 minutes with Medicare is done. And so sorry you have so many problems, pick the top three. Like there's nothing like that.
yeah.
And it's really like, let's talk about everything. Health is, it's not just the disease process, but it's also how to prevent the disease, what your level of stress is,
Mm.
what you're eating, just kind of a more holistic approach,
Yeah. And I've heard it said that it's like an ongoing conversation over
basically.
years, maybe,
Yes, yes. And I think that's the greatest gift you can really give your patients is to have somebody, to be that person who is your confidant but they're trained over decades to be able to see when something's wrong.
Yeah.
And so, if I know someone well, there might be something very subtle that they wouldn't have picked up on, and maybe even their loved ones wouldn't, that I would be able to see because of my trained eye.
Yeah. That sounds wonderful.
Yeah,
Are you
I think
pumped?
so. I'm so excited. Yeah.
Yeah.
Yeah. I mean, I'm thrilled because I, started in public health. I did global health. I worked in HIV/AIDS in Africa.
Mm.
And it was amazing. But the reason I left global public health at the time was just because I would get into the communities and not have, like, the clinical tools to take care of them in front of me. So I was really good at, like, cutting ribbons and doing reports and, like, being in fancy events, and it was very glamorous, and I got to meet a lot of cool people, but I didn't feel like I was really, like, serving, and I wanted to go back and do something with my hands, and so that's why I went back into medicine.
Yeah,
Mhm.
I love that.
Yeah.
Well, Nadia, thanks for joining me.
Thank you.